I think that we are still wasting a lot of time on important issues. We are not concentrating enough. For example, cancer. What's being done about that? What resources are being spent the world over for research?
In honor of King Hussein's memory, King Abdullah II established the King Hussein Cancer Center with the mission to provide the most advanced cancer care to every Jordanian and every Arab. 20 years on, the KHCC shines as the only standalone, comprehensive, internationally accredited cancer center in the region and has become a lifeline for thousands of cancer patients. To ensure that no one would be deprived of treatment due to the lack of space, we embarked on a major expansion project in 2011. Our state-of-the-art facilities increase the KHCC's capacity to provide integrated space for patient care, education, and research. Take our patient-centered approach to cancer care to greater heights. Provide our patients with increased privacy and comfort. Offer an outdoor sanctuary to promote healing by providing greater serenity. And the children at the KHCC receive the most specialized attention in child-friendly spaces that provide them with facilities dedicated to treatment, recreation, and the chance to continue their education. The KHCC's jewel in the crown, its bone marrow transplantation program, is one of the largest in the Middle East, is able to perform 300 procedures annually with success rates commensurate with international standards. With this expansion also comes an evolution in cancer care technology. Our facilities now boast 13 operating theaters, including an intraoperative MRI for the neurosurgery suite, which integrates advanced MRI technology with the most sophisticated brain navigation system. Additional advancements for cancer treatment at the KHCC include expanding our diagnostic imaging services and introducing the ambient experience, a technology deliberately designed to create a positive, interactive environment for patients during imaging. Our state-of-the-art cell therapy and applied genomics lab includes the first and only public umbilical cord stem cell bank in Jordan. Medical education is paramount to us. Our medical educational center and highly qualified medical team allow the KHCC to serve as the regional hub for superior oncology training. This is our story, a Jordanian institution that has grown into a world-class, life-saving cancer center. This is the legacy of King Hussein. This is the vision of King Abdullah II. This is the pride of Jordan.
All right, we are indeed very proud of this world-class life-saving center that carries the name and legacy of someone who we dearly love and miss, King Hussein, Allah yarhamu. The King Hussein Cancer Center. And today it's all about this magnificent Jordanian success story. Your Royal Highness, ladies and gentlemen, on behalf of my colleagues, members of the Steering Committee of Connect.jo, members of KHCC, KHCF USA, Ahlan wa sahlan, and thank you for joining us. To learn all about the center, it's my privilege to introduce to you a passionate advocate who has tirelessly committed herself to the fight against cancer and is always seen by the side of cancer patients and their loved ones. We are proud of everything she has achieved in her mission to save lives. So please join me in welcoming Her Royal Highness, Princess Ghida Talal. Her Royal Highness grew up in Beirut for a Lebanese family. She then pursued her college education at Georgetown University School of Foreign Service here in Washington, D.C. You're a Hoya, Your Royal Highness, and we have many Hoyas on the webinar today. She graduated with honors with a joint bachelor and master's degree. She started her professional career as a journalist before fate took her to Amman, where she would marry His Royal Highness Prince Talal bin Muhammad. Her first difficult post was when His Majesty King Hussein asked her to establish and lead the International Press Office at the Royal Court. And then in 2001, her wish and dream came true. His Majesty King Abdullah was determined to establish KHCC and named her as the chairperson of the Board of Trustees of both the King Hussein Cancer Center and Foundation. She's on the board of IIE, which is the International Institute of International Education, and a board member of Georgetown University's School of Foreign Service. Today, I'm also joined by Ms. Nisreen Qatamish, the CEO of KHCF, Mr. Fawaz Bilbaisi, advisor to the executive director at the World Bank, and also a board member of KHCF USA, and Dr. Rami Rihani, managing director at Accenture and the president of Connect@Joe. My name is Fadi Samara. I am also on the steering committee of Connect@Joe and the Jordanian American Association of Washington, D.C. Your Royal Highness, I'm going to give you a minute or two if you want to give your welcoming remarks before we jump into the exciting details. Welcome.
Thank you, Fadi, and good evening from Amman, Jordan. It's the evening here in Jordan. I have to say how thrilled I am to be with each and every one of you. This is something I have looked forward to for many years, actually. And I want to thank you for your time, and I want to thank you for showing interest in hearing our story. Fadi, Dr. Rami, and Fawaz, you have been instrumental with your team, with, of course, Connect@Joe, in allowing this event to happen. And you have been with us constantly behind the scenes, wanting to ensure the success of this meeting. Thank you very, very, very much.
It is our pleasure.
Thank you. I would like to, I know that our Ambassador Dina Qawar is with us today. I would like to welcome her to our forum and thank her for her consistent, steadfast support of the King Hussein Cancer Foundation. I would also like to thank and acknowledge the president of KHCF USA, Yolanda Gasaya, and other valued members who are in the audience, along with, of course, Fawaz, who is one of a huge asset on our board. You saw the video. We have in Jordan a medical jewel, and this medical jewel is the King Hussein Cancer Center. It is the only comprehensive, standalone cancer center in the entire region. It is treating or providing the most advanced cancer care to patients across the region, as well as to hundreds and hundreds of refugees who have flocked to Jordan for safety. The King Hussein Cancer Center is, like as I said, is a jewel, and is basically, it addresses the cancer needs of our region in terms of treatment, in terms of research, and as I said, in terms of refugee help. And we work very hard on many layers across our region. We actually have translated words into action. We, we pull our sleeves up and we work. And as a result, KHCC has become the cornerstone, the medical cornerstone of the region. The reason why it was so important for me to meet you and speak to you is because our story is a wonderful story. And I know that you all live at the moment in the United States and work there. I know that a big piece of your heart remains in Jordan and in the Arab world. And I also know that you must have many family members who are still living in the Arab world. And God forbid they ever encounter cancer. I know that you would want to know that they are in the most secure of hands and in a center of excellence. And this is why I wanted you to know.
Indeed. Thank you for the kind words. And to reiterate, Her Excellency Ambassador Dina Qawar has been always supportive of all our Jordanian organizations. So thank you for that, Your Excellency, and thank you for being here. Your Royal Highness, before we get into, I know the story is very exciting and we have so much here to cover, but before we get into it, like many of us, you had, cancer hit home for you early on in your marriage when His Royal Highness, Prince Talal bin Muhammad, was diagnosed. Do you mind sharing part of that story with us? And how did that shape or change your perspective on where things are today?
Absolutely. It's obviously a very important part of the story. And as you said, Prince Talal and I were newlyweds. We had just gotten married a few months before. The year was 1991. At that time, cancer was a total synonym to death. So, of course, when it hit us, we were absolutely terrified. I mean, cancer, we never even thought that we would hear that word. We didn't even know what that word meant. So yes, we were terrified. And very, very quickly, you realize that there is a life that needs to be saved, that we actually have no choice in front of us. So we proceeded to find the best possible place that Prince Talal could undergo, where Prince Talal could undergo treatment. And that place was Memorial Sloan Kettering in New York, one of the two best institutions in the United States. So as Prince Talal was undergoing his treatment, and of course I was next to him, and the hours are long as in a hospital, I couldn't stop thinking of Arab women like me who did not have the privilege and therefore the opportunity to be able to take their loved one to the best possible center and have a chance to save their lives. So I was so aware that the only difference between me and them was access and privilege. And this is when I made a vow to myself that inshallah, when Prince Talal would recover from his cancer, the first thing I would do when I would come back to Jordan was work for the establishment of a cancer center of excellence so that the Arab world, people in the Arab world could have access to the same treatment that my husband and I had. You all know, and you live in the West, you know that to treat cancer, it either has to be very advanced treatment or you might as well leave it. You cannot treat it halfway. And this is why it was absolutely my determination to do that. And this is my personal story, and I have devoted my life to it. And of course, in that story, the one element that always guides me is the cancer patient. So everything that we do, everything that we breathe is for the cancer patient.
What a story, Your Royal Highness. I think many of the people on the call also have had to deal with this. I know my family back home in Jordan are dealing with that at this moment. So we pray for all our patients. Obviously, your commitment to fighting cancer is partly driven by your experience going through that with not only His Majesty King Hussein, but also His Royal Highness Prince Talal, whom, by the way, we send our sincerest regards to.
Thank you.
And once a dream was made a reality by the vision of His Majesty King Abdullah and by your leadership. And since then, you've transformed KHCC into what it is today, a medical jewel of Jordan. Take us back to 2001 and talk to us about that journey. How did it feel being in charge of such a complex undertaking? Because I reckon it was a very difficult task for you to accomplish.
You just have to have your values, your priorities, your determination in order. There was no way that people were going to continue dying from cancer unnecessarily. And I just could not live with myself. So, of course, you build it step by step. And my first task, if you want, was to put together a very strong, capable, committed board of trustees that helped me, guided me, and was always by my side. Together, we assembled. We had nothing. You just have to know there was nothing in Jordan. You know, going to get cancer treatment was tantamount to going to the morgue. I mean, there was absolutely nothing. So we assembled, first of all, a very strong medical team, an Arab American medical team, people like you. We went on a big journey of brain gain as opposed to brain drain. We spoke to the doctors. We told them at least our projected story. We convinced them that we would provide the right academic environment for them, and that they would be also helping their communities. The academic environment is extremely important, as you know. Our doctors can go now anywhere in the world and they would be the most highly placed. We are also, of course, a teaching hospital. So we assembled the medical team. That was the first step. And then as we were beginning to accumulate successes, we established partnerships with the best in cancer care worldwide, such as a very strong partnership with MD Anderson Cancer Center and with St. Jude's Children's Research Hospital. You can imagine, Fadi, that a hospital like MD Anderson will not establish a partnership with you unless they felt that you really had potential and credibility. So this was the medical partnerships. And of course, also the accreditations. We kept receiving great accreditations from JCO, the American Hospital Accreditation Committee, the last of which placed KHCC as the #1 in the developing world and the #6 worldwide as a cancer-specific center. So we had the medical team, we had a great board, we had the medical team, we had slowly the partnerships and the accreditations, and this is when we reached the stage where we felt we were giving cancer treatment to our patients at par with international standards, at par with US standards. And this was the journey over 20 years nearly now.
What an amazing story, building it from ground up to where it is today. I can't imagine going through that, but I'm pretty sure by with your leadership and the teams that you have, whether it's KHCF or KHCC, and also, not to forget mentioning the physicians and the nurses and the technicians and everyone that works in the background, especially during this time, they deserve our thanks and appreciation.
Fadi, they actually don't work in the background. They actually are at the forefront. We are behind them. They are the true heroes of this struggle, and particularly now in the Corona phase. We are so proud of what our doctors and health professionals have accomplished.
Absolutely. Corona took over our lives, and now that's the only thing we can think of, not recognizing that cancer exists, have existed, and will exist, and we can't lose sight of that. Let's turn our attention, Your Royal Highness, to the operations of the center. We all know how costly it is to treat cancer patients. So how do you run the operations? How do you fund the operation? And also, what about those who are in need, especially whether it's in Jordan or from the region? As we know, we treat many patients, whether it's refugees or what have you from the region. Can you just give us an idea of how do you fund the operation and what challenges do you face in this regards?
As you can imagine, Fadi, the budget to run an operation like the King Hussein Cancer Center and Foundation, but especially center, is huge, absolutely huge. Having said that, I have to tell you, we are a non-profit, non-governmental, but that doesn't mean we don't charge money. The patients who come to KHCC, I'm not talking about the underprivileged, I'm talking about your run-of-the-mill patient, pays for his treatment. But most, if I don't want to say if not all, but most of our patients are subsidized, okay? For example, from the government, with what we call referrals or afa. I'm sure many of you are very familiar with that. However, this takes care, as I said, these treatment revenues, okay, they take care of the operations of the center, of the running of the center, of the salaries, of the conferences, of everything. Anything that comes for fundraising, every penny that is donated goes entirely to the patient, his treatment, and the machinery that is needed for his treatment. So it's very important to make that very, very clear, that nothing, absolutely nothing goes towards operations from fundraising money. Now, having said that, we have a huge fundraising burden on us. First of all, everyone is poor before cancer. I don't know how many we are in the room tonight, but I can safely say that very few of us can pay for our treatment revenues without support. And this is where the King Hussein Cancer Foundation, under the leadership of Nisreen, comes in. So the foundation has a multitude of programs, of campaigns, of initiatives in order to fundraise for the center, meaning for the machinery and the underprivileged patients. Because the situation was getting so dire, and you have to know that the burden on the government is extremely high, the cancer burden. So as a result, they are not being able to take on really as many patients or to follow as many patients. And what the government is doing, because everybody thinks that every Jordanian is automatically guaranteed for treatment of cancer. Yes, every Jordanian can be treated for cancer, but not every Jordanian can be treated at the King Hussein Cancer Center. So they will be farmed out to hospitals like Al-Bashir or that are completely unequipped for cancer treatment. And personally, I would advise anyone like that to stay home. So the fundraising arm that we have is extremely important because we are able to sustain underprivileged patients and the hundreds of refugees that knock on our door. Even though it is not technically our mission to pay for a patient's treatment, our mission is to treat the patient. We have taken over that task to treat cancer patients. So I just want to give you an idea. We instituted goodwill funds at the foundation for underprivileged patients. From 2013 until today, we have treated about 5,000, Nisreen, something like that. Yeah, 5,000.
Yes, almost
yeah,
5,000.
5,000 with the money given to the goodwill funds from Ahl al-Khair, from people, from Good Samaritans. We have treated about 5,000 underprivileged patients to the tune of $120 million. So it just gives you an idea about how high and how important the fundraising burden is. And like I always say, it is truly not important the amount that is given. What is important is the engagement of the community together, and it has been proven to us. Together we can raise an enormous amount if each one of us just commits a very small amount. So this is what's happening with fundraising. And I have to tell you something. I would like to ask Nisreen to say a couple of words, because we, as I told you earlier, our main goal is always the patient. And we have noticed that the patient is more and more becoming vulnerable, no sources of revenue. The government, I have to say, turning their back more or less. And so we, for 3 years now, have worked on a proposal to protect the patient and the families that I think everyone in your audience should be aware of, because I'm sure you have relatives in Amman. So I would like to ask Nisreen to say just a couple of words, Nisreen, on our insurance program.
Yeah, sure, Siti. So as Princess Ghaida mentioned, as we all know, cancer cases are increasing and the burden is increasing. And the current formula of financing cancer care in Jordan is really not sustainable. Having the government covering everybody is not sustainable. And that's why we were proactive, worked on a solution, a sustainable financing solution for cancer care, not only for Jordanians, but also for people who are living in Jordan, actually, and the region, which is a cancer care insurance, a national scheme for insurance that gives a direct and immediate access to our quality and comprehensive care at the center. So this insurance program is the only way to go forward. We cannot sustain our operations, and we cannot sustain and make sure that all cancer cases have the access to our comprehensive cancer care without a solution that have some of the individuals, the people who can afford it, take some part of the responsibility. Today, more than ever, and we worked on that for 3 years now, but today, more than ever, we need this solution to be the only solution for the country. It's not for the King Hussein Cancer Center, it's for the cancer patients, it's for our people, it's for our country. This solution will support the government and the cancer patients as well. So I urge each one of you, please, to have a look in this program and encourage your families and friends who are living in Jordan and the region to have this insurance as an option. It's affordable. The premiums are so small amounts, but as I mentioned, it will save the patients and their family from the burden of looking for someone to finance their care at KHCC.
Absolutely. You know, I had never heard of the Inaya program until recently. And I'm going to subscribe for myself and my family, because I think, it's great. It could be any of us at any time, and any of us will want and will need help. So I think, it's going to take a village. You look at the largest institutions, take St. Jude, for example. It's all about the community engagement. It's all about people rallying together And just like you said, it's not for the benefit of the center, it's for the benefit of the cancer patients, who have other things to worry about than having to worry about paying for their bills. So let's turn our attention, Your Royal Highness, to something very important in the world of cancer, and that's research. We know that we cannot advance our agenda without advancing the agenda of research and being able to be at the forefront of that. I think we are. KHCC is leading that. And congratulations to you and to your team on launching the King Hussein Award for Cancer Research just recently in honor of His Majesty King Hussein bin Talal, with the aim of encouraging and recognizing cancer research in the Arab world. Where are we in terms of research? And what's next?
We are, I'm talking about the Arab world, in a terrible situation in terms of research. We are weak. We don't produce much. We just kind of relax. We don't think that there is maybe a need to research. We rely on the research coming from the West, and we are so wrong, so wrong. A few years ago, I called actually for the establishment of a cancer research fund for the Arab world, because it is impossible for one country to tackle tackle research on its own. Not one Arab country has either the population density, الكثافة السكانية, nor does it have the resources, nor to be able to do research on its own. So this is something that has been on our mind for many, many, many years. In terms of us at KHCC, I wanted very much to get to the stage where I knew that our treatment was at par with US standards. Anything short of that, it didn't make sense to start talking about other venues. So once we felt reassured that we were truly providing our patients with the best treatment, I started very strongly talking and thinking and going after research. At the King Hussein Cancer Center, we have, of course, already started. Is it enough? No, of course it's not enough, but at least we have started and we have established the basis. And we have joint research projects with MD Anderson, with many institutions outside. So right now, with this prize, why this award was so important, besides the fact that it honored the legacy of a truly great man, and a man who fought so hard to combat his cancer and unfortunately lost it, our beloved King Hussein. But I was adamant that this award would not be an empty award, like so many prizes and awards that one sees. This is why the board of the board of the award is an internationally recognized board of scientists and researchers from Oxford University, from MD Anderson, from Belgium, in order to really basically set us straight, guide us, tell us what to do, expect deadlines and timelines. Anyway, as you said, Fadi, without research, we have nothing. The future of cancer lies with research.
Absolutely, absolutely. Now we're going to turn to KHCF USA. And for that, I will be joined by a dear colleague of mine who has also worked tirelessly since 2014 on Jordanian issues. He's been serving as a board member of the Jordanian American Association of Washington, D.C. He does everything in his capacity to help us out, grow the organization, and be able to be more effective here in Washington, D.C. and in Jordan. He recently joined the board of KHCF USA, He is also passionate about King Hussein, and he'll tell you the reason why he joined the board. So Fawaz, please tell us a bit about KHCF USA and why now that we are coming together to advance this.
Thank you, Fadi, and thank you, Your Highness, Princess Reida, Nasreen, and Rami for all the great work. And thank you for this inspirational story. I say it's inspirational because really, Princess Reida, you inspired me into this, and I feel it was transformational for me. Yes, as Fadi said, I joined recently the board of King Hussein Foundation USA. It was created for the sole purpose of supporting the mission of King Hussein Cancer Center in Jordan, with with generous contributions from American entities and American individuals. We are a board of 12 people. We are all volunteers, and they are all dedicated and passionate to this cause. And some of them are from Jordan, some of them are from the Arab world, there are Americans, and they are all really amazing people who are very dedicated and passionate about this cause. And I'll tell you why we are all passionate about this cause. I mean, there are many causes around the globe, and they're very important, and they're all really instrumental for human lives. But cancer for Jordan is a leading cause of death. It's a leading cause of pain and agony for Jordanians. This is a very relevant and very important action or plan of action for all of us, because there is no one Jordanian family, and for that matter, an Arab family that didn't lose a loved one, a dear one. So this is very relevant. I think in Jordan, cancer is the second leading cause of death after heart disease. And as Princess Reida said, the King Hussein Cancer started from scratch, from nothing. There was nothing in Jordan. Now people have hope of being treated, of living and surviving this cancer. So it was for us, and I speak on behalf of the members of the board, for us, this is a direct alleviation of the pain and agony of people in Jordan and the region. And it gives us a lot of gratitude and sense of purpose to be able to help these Jordanian families, even with the small amount of work that we do here in the US compared to the great giant work that is done by all the frontline workers, the doctors and the nurses in King Hussein Center in Jordan. In addition to this being very relevant and urgent for Jordanians, listen, we just saw in the video at the beginning of this webinar, His late Majesty King Hussein. I mean, who's not only in Jordan, across the whole world doesn't tear up, doesn't feel something in their hearts when they hear or see the late King Hussein. This organization bears and carries the name of King Hussein. And for me personally, I mean, this is the greatest thing I can do, the most sincere expression of love for this great man. This is to contribute to this cause, because it is his legacy. It's in honor of his memory. So that's another reason why I feel so passionate about this. Of course, we heard from you, Fadi, and for Princess Ghida, that Jordan, really in Jordan, across the world, there are only a handful of organizations that make us really proud. Organizations that are of a global scale, state-of-the-art work, very efficient, at par with the leading global organizations in their field. And really, King Hussein Cancer Center and Foundation gives us this sense of pride. And I'm sure I speak on behalf of all of you. There's no one that didn't hear about this great organization and the great work they do. And I think it earned our support, it earned our dedication and help. And for these matters, I mean, I wake up every day. I say that was transformational for me, and I hope it will become for the same for you. I wake up every day not thinking, what can I do for myself? Now I wake up every day and I think, what can I do for families in Jordan? Those people who are waiting in the waiting room, waiting for a kid or a dear child with cancer. And I think this by itself, it's the most fulfilling thing that one could think of. We are really, really keen and looking forward to partnering with Connect.jo. We want you to be part of this journey with us because it's worth it really. And we're hoping for a partnership on two levels, an organizational level, where we together as two organizations could work together on for example, planning events, fundraising, and activities across the US, support through the Arab businesses that are in your respective states. Let's think together, let's brainstorm as two organizations, how can we take this forward and be part of this success, be part of this this great journey. On the second level, to work with you as individuals. We want to reach the grassroots of Arab diaspora. And you are the right address for us because you are very representative of Jordanian and also Arab diaspora in all states of America. So we want to reach individuals, and your contribution could be as simple as partnering with us on Barnamij Inaya or the insurance, pay for a loved one to insure them, send it as a gift for a family member to insure them against cancer. Or if you have, refer your relatives or your loved ones to diagnose themselves and get care in King Hussein Cancer Center. There are a lot of ways to support this great organization. There is a lot, and you heard it from Princess Ghaida. She said that Arab Americans built the cornerstones, the founding stones of this center. So maybe it's up to you now as Arab Americans, as Jordanian Americans, to carry the torch forward and to take this journey to new levels, to new skies. And I can tell you, Her Highness Princess Ghaida is very dedicated, very passionate. And you know, this is probably the only non-governmental organization in Jordan that I see consistency, in success and efficiency and in performance. So I can assure you that in 5 years, in 10 years, those people who are working on it and the new people who will join, they will be as dedicated, as passionate, and as successful in alleviating the pain of Jordanians. So we really look forward to this partnership, and we want to hear your ideas and creative proposals on the way forward. Thank you so much.
Absolutely, absolutely, and I'm loving the passion for Fawaz. Fawaz is very passionate when he wants to do something.
Thank you, Fawaz. I shouldn't have spoken. I should have just let Fawaz speak.
Thank you so much. It comes from the heart.
We turn our attention to the second part of this, which is Connect.jo, also a very dear organization to myself, and I know to Rami, who's the president. I got to know Rami a while back, and he served 2 terms as the president of the Jordanian American Association, and I know Connect.jo is in amazing hands. So I'll let him talk, briefly about what Connect.jo is and what this partnership with KHCC and KHCF means to us.
Thank you, Fadi. And first off, thank you, Your Highness, on attending and giving us a very personal perspective on the center, and that's very duly noted and appreciated. And I wanted to also thank your team, Fawaz and Nasreen and Jennifer, who's on the line with us. We've collaborated the last few weeks to make this webinar happen, and obviously Fadi for spearheading our efforts to get us together. You use the terms brain gain and brain drain. That's really what Connect.jo is about, fighting brain drain. We were founded as a nonprofit US organization back in 2014. We're a very young group. We were invited to a meeting with His Majesty King Abdullah II at the University of Berkeley in 2014, where myself and a few others who became in the steering committee attended, and His Majesty he was there to meet executives, American executives from Silicon Valley. And, we talked to him about starting this network, and it was very much encouraged, and we hit the ground running. We are a small group of volunteers, and like our name says, our aim is to really connect the professional Jordanian. Right now we're focusing on the US, but the Jordanian in the diaspora that has left Jordan. Myself personally, I left next year, it'll be 30 years when I left Jordan. I did my undergraduate in Amman, but I've been living here in DC mostly, and always wondered, how do I give back without having to be back? What can I do from here? So one of it is fundraising, one of it is building these connections. And that's really what came out of really our network. And if it's okay, I'd like to just share a simple figure that we use of how to explain our network. There are points of interest in Jordan, whether educational institutions, for-profit, nonprofit organizations, just as the King Hussein Cancer Center, if you will, or maybe government agencies and municipalities. And then us in the diaspora here in the left, we have professors, we have subject matter experts in a varied set of topics. We can provide and help with market access and connections, and obviously with funding. And we sit in the middle. This is what Connect.Jo is about. We're trying to connect these Jordanian professionals on the left with points of interest in Jordan and meet in the middle, whether, we're very ambitious and have a lot of ideas to have scholarships and have more campaigns. And, we're super excited to have this relationship with King Hussein Cancer Center. This is really where we see a lot of potential in the future to advance the relationship. Like you said, maybe in research. We have a lot of members that are physicians and doctors, and there's other sister organizations in the US that are physicians, right? President of one of them, called Jaha, was on the webinar earlier. So this is the Jordanian American Healthcare Provider Association. So we are building connections with them, whether at the community level or at the professional level, and our aim is to link it with, like I say, points of interest in Jordan. So this is in our wheelhouse. Really, this is really what we're passionate to do, and we look forward to continuing to work with your team to advance it further. So thank you very much for
not just with the team, with me as well.
Of course, you're the head of the team.
So, to say something that we probably don't take as much credit for things that we do. But when the pandemic started, we jumped on a fundraising campaign to help out in whatever we can. A lot of people are facing hardships these days, so it was difficult to fundraise at this time. But we did, and we are very proud that part of what we raised was used to purchase an ultrasound for KHCC. So we've started the partnership. We want to build on the partnership. We want to continue forward because I think the sky is the limit for us. We can work together on a lot of these issues.
Can I say something, Fadi?
Yes.
And what Dr. Rami was saying also. This is exactly what I have always been yearning for. I really, I would, I'm not asking for campaigns or fundraising. I want engagement. I want you to believe in our story. I want you to truly believe that the King Hussein Cancer Center is saving hundreds of patients in the Arab world, our mothers, our fathers, our children, people who don't need to die. So, so this is Connect.Jo. I would love engagement. The connection, the connect, as you said. You see something that would benefit us, someone that could be of interest to us in the world of research, and tell us, and vice versa. It would be invaluable. I often say that when one is in a webinar or in a board meeting, everyone is very, very excited, as we all are, but at the end of the day, people have their lives, and it goes back to really the people who breathe in and breathe out the matter. But it's the first time we meet, but I really have a strong feeling that it's going to be different with Connect.jo. So I would really welcome, regular updates with each other in order to maintain the engagements. And I know that you want to move to questions and answers. If you were to ask me, the community came, many people came to listen, to join this webinar. What do you really want? Besides, of course, telling the story, I would ask you if each one of you would consider becoming an ambassador of the King Hussein Cancer Center. If you could tonight go home, or this afternoon, or go to work, back to work, or whatever it is, and tell the story of this center to only one person, this is the only thing I really, really want.
Absolutely, and that's the least we can do.
Yeah,
Royal Highness. Let's go ahead and take some of the questions. Maybe this one is for Nisreen. I think this is in regards to the Inaya program. Does it cover anyone with pre-existing conditions? Are there any parameters that would limit anyone to signing up for Inaya?
Yeah, first of all, it's Reida.
Reida, sorry.
Yeah, okay. It's an actuarial program at the end of the day, and it's an insurance program. And I want to reiterate that it's an actuarial studied program. It's a well-studied program to ensure its sustainability and ability to cover patients as much as possible. With regards to pre-existing patients or survivors, we are now working on different options and alternatives for them. At the end of the day, it's our mission to save lives. Of course, KHCF and KSCC will never ever leave a cancer patient without any kind of support. So it's our mission always to ensure access for all cancer patients, and for survivors in specific, if they need it at any time to get back to treatment. Of course, it's our mission and it's our commitment as the foundation and the center to ensure the continuity of their care. And now we are working on a special model for them under the cancer insurance program, Reida, to also give them an access and an insurance through under the umbrella of Reida. There is no limitation or conditions for anybody to be a member in this program. As I mentioned, there's no restrictions in nationalities. There's no restrictions on age. We can insure someone who is 100 years and more old. So there's no any kind of restrictions, and we are now and every now and then revisiting the program to make sure that it's accommodating everybody's requirements and needs, and as I mentioned, ensure access to the quality of care and continuity of care, which is the most important part.
So رعاية مش عناية. أنا كنت غلط وما حتصلحني من أول. Another question, actually, Rami, before we continue on, do you mind putting up that slide that shows the link for the joint fundraiser between KHCF USA and Connect.jo? As we go down the list, I think this is for you, Your Royal Highness. Clinical research is an important dimension of cancer care. What efforts has the foundation taken to integrate clinical research with clinical cancer care? And what can the diaspora do to help here?
I'm very happy to help, but I think, Nisreen, you are involved more in the details of this.
So the question, Nisreen, is what efforts has the foundation taken to integrate clinical research with clinical cancer care? And what can we do to help as people living outside?
Yes, okay. Actually, as mentioned by Princess Reida, research is one of the main priorities and key pillars for KHCC and the doctors at KHCC. We are doing several clinical research projects with different institutions here in the Arab world and in, for example, in partnership with St. Jude, MD Anderson, and other entities as well. So there is a team dedicated and led by Dr. Hikmat Abdel Razak, our Chief Medical Officer and Deputy of the General Director of the Center. And we are very much interested in clinical trials and clinical research in specific. We can link anybody who is interested in this area in specific with our research team headed by Dr. Hikmat Abdel Razak.
Sorry, I think if the gentleman or the lady asked if we're actually integrating our research in our own clinical care, I do not have the exact answer for you, but I can find it out and I will get back to you if you are kind enough to tell me to who the, I will do it through you. If you know the person who asked that question, I would prefer to give a more precise answer. But my guess is that we are not at the stage yet where we are integrating our own research onto treatment.
Yeah, we very much know the person. He's a cancer researcher himself. He worked at the NCI, graduated. Okay. He's a Hoya, and he's now with one of the largest pharmaceuticals focusing on cancer aspects.
So I will get him exactly the answer.
Okay, perfect. We'll move down the line. Thank you, Your Royal Highness, Ghaida, for the incredible work. My question is for both Your Royal Highness and Nisreen. What are the priority areas for women's cancer research at KHCF? He graduated from MD Anderson with a PhD in cancer biology and currently an assistant professor at Harvard.
This is very intimidating. Couldn't you have just left the question on its own? Okay.
Just more context.
We're actually very, very proud. This is the work of the foundation and the Jordan Breast Cancer Program. It's a national program with the involvement of the Ministry of Health. And just to tell you how much it has accomplished, that basically 7 years ago, 70% of women used to come to us at the late stages of their disease, stages 3 and 4. And because of the incredible work of the Jordan Breast Cancer Program, which was initially led by Nisreen, actually, and we halved the numbers. 35% now of women come to us. Of course, we would want to constantly, improve the statistic, but it is really quite something to halve it from 70% to 35%. You can imagine the amount, of number of women who were saved as a result, as well as enormous campaigns that go way beyond the pink ribbon to every basically village in Jordan, every area is speaking. Okay, Nisreen, now I'll hand it over to you if you want to say anything about breast cancer.
Yeah, so our priority for breast cancer is really early detection and making sure that women are diagnosed at early stages, because this was the main challenge when this program was established. And we adopted a holistic and comprehensive approach to address this issue that handle both parts, the supply and the demand of the services. So we made sure that there is enough mammography units and screening units available across the country and accessible by all women, and specifically women in remote areas and underprivileged areas. And for those in specific, we also are operating 2 mobile mammography units in remote areas and underprivileged areas, and referring women from these areas to get their mammograms freely. And then if they are diagnosed with breast cancer, we also cover their treatments from the Goodwill funds, through the Goodwill and Zakat funds. So this is from the supply side. To increase demand on the services, as Princess Ghida mentioned, we have a very comprehensive and strong outreach program that really do implement home visits, outreach activities, lecture, educational activities at different stages and at different levels and in different formats, to make sure that the information is also, and the awareness is also delivered in a very scientific approach to all women who are living in Jordan. So this is about the program. Our priority, as I mentioned, is downstaging, because this is the main challenge that we have at the moment. There is no need for women to lose their lives because of lack of awareness or denying of accessibility to quality care.
Absolutely. Thank you.
Can I add just one thing? I just wanted to say that I don't know, maybe the audience might not know that, is that besides, of course, the treatment, what is a priority for me and for the center and the foundation, of course, is to literally take care of the patient from start to finish, and especially his mental care. You can just imagine what happens when you get a cancer diagnosis, especially in our part of the world. So we have a strong psychosocial support system. And as well as when the patient is getting treatment, the Goodwill funds that we have been mentioning to you, they're not just to take care of the treatment of the patient. We take care of everything for the patient. We take care, we pay for the transportation of the patient. We pay for the accommodation of the patient. We have 2 semi-hotels next to the King Hussein Cancer Center that accommodates the patients and their families, because as you know, cancer care takes a very, very long time. And also it needs security and safety. They cannot be undergoing chemotherapy and then going back to whatever, a village where they're living, everybody is living in 2 rooms. So we take care of treatment, of accommodation, of transportation, as well, and we also feed many patients, because many patients, underprivileged patients, don't even have money to eat.
Perfect. We'll take 2 more questions from this side,
Can
and
I-
then
Fadi, can I add just one extra pillar that King Hussein Cancer Center and Foundation have been very instrumental in? This center has become a very important tool of advocacy in Jordan. They're changing policies, they're improving insurance terms, they are raising awareness, and they've been really instrumental on this. Organized entities, government and non-government and private sector entities never insured their beneficiaries for mammograms and early diagnostics tests. And with the help of advocacy and the I don't want to say lobbying, but the advocacy really, and the pressure from King Hussein Cancer Center and Foundation, we're seeing these things finding their way in Jordan, and correcting many of the wrongdoings that we had in Jordan that prevented the early diagnosis and the preventive care for the cancer. So I really would like to thank you all for this, Your Highness. Another important thing, how you treat refugees. I mean, a lot of refugees from around the region who either found their way in Jordan or they came to Jordan just for the specific case of being treated for cancer, and how you take care of all these refugees with all the the services that you've just mentioned. I mean, this should inspire our brothers and sisters from around the region, the Syrian doctors. We know in America there are hundreds or thousands of Syrian doctors and physicians from all around the region. I mean, the center is caring more about Syrian children, underprivileged children, than probably Jordanian, because none of them can afford it. So let's work together on spreading the word on these two things, the refugee aspects and the advocacy, which is as important as the healthcare also. And speaking of advocacy, I just want to say a small example as a testimony to how this center is very keen on quality, on performance, and really state of the art. I mean, I've been watching on Jordanian news a doctor who speaks about COVID-19, and I was so impressed with this doctor, very qualified, very professional, and really knows his stuff very well. And at the end of the interview, they showed the title, and he is from the King Hussein Cancer Center, Dr. Firas Hawari. What an impressive person. I think he speaks better than everyone I heard from in Jordan on the COVID, so yeah, that's again, as I said, a testimony of what we said, the dedication for and the commitment to excellence and best performance.
Excellent.
Thank you.
Rami, I know you have a few questions coming in from Facebook. Do you want to take a couple?
Yeah, let me run it. One of them was actually from, I see as a Jordanian surgery resident that from her Facebook profile is in Baltimore, not far from DC. And she's asking, how can a resident like myself collaborate with you and help the foundation?
I think we very much welcome any interest. I think when the webinar is over, I think between Jennifer or Nasreen, if we can have her contacts, and we can start the communication.
Absolutely. All right. Thank you. Another question was about preventive medicine, right? Is an essential part of cancer management. Are there any push towards these preventive measures to be covered by insurance companies, whether it's smoking cessation or routine mammograms? Maybe this is tied to another question about, are the laws in Jordan supportive of fighting cancer? Should there be changes in the legislative system to sort of help you in your mission?
Yeah. Okay, as for the first part, as Mr. Fawaz mentioned, we are working on the policy level really to advocate for an enabling policy environment in terms of laws, regulations, and insurance schemes here in Jordan. We managed and we succeeded to include the mammography, the early detection and screening mammography within the public insurance scheme. And as you know, 70% of Jordanians are insured under the public insurance. And to make sure that they have the access to quality care, as I mentioned before, we are operating the 75 mammography units at the kingdom, and we are making sure that all these units are operating with the same standards of the units at the KHCC. So this one part. As of the prevention, smoking cessation, tobacco control measures, we all know that Jordan are not doing very well in this. It's not the lack of regulations or law the problem. As we all know, we have very strong law, we have regulation, but the problem in Jordan is the enforcement of the law and the implementation and the enforcement of the law by everybody and the implementation of the law by the citizens. So what we do as the foundation, we are trying to lead the behavior change from communication campaigns and community mobilization campaigns from one side, and from the other side, we keep putting pressure on the decision makers and policy makers to activate these laws and enforce these laws. For one example is the ban of the law of ban of smoking in public places. We are consistently putting pressure on everybody to implement this law in cafes, in restaurants, in public places, in schools, even in universities, and in different public spaces, including the government entities as well. It's a very tough war, as you all know, but we are trying to do our best at this side. And we are doing consistent work and outreach also, not only for breast cancer. Now we are expanding to promote healthy lifestyle at different levels, healthy eating, smoking cessation, and exercising, and all of these things. And the good news that we didn't allow Corona to stop us from this part as well. Yes, our number one priority is to ensure continuity of the treatment for our patients at the center, but also outside the center, we continue to promote for healthy lifestyle, and we continue to do our work, and we completely transformed into the digital platforms to make sure that people keep thinking about their well-being while facing all these challenges that we have. And as Princess Ghida mentioned, also we integrate mental health now strongly in our work, as we all know today more than ever that mental health is also another very important element of prevention and early detection, as well as comprehensive care for our patients at the center.
No, thank you for that. Yeah, thank you for that response. One last question. I think it's sort of related to COVID-19 in Jordan, and the question was about, I mean, arguably COVID is, for those that don't have a high immunity, or maybe they're susceptible or have pre-existing conditions, can probably not fare well if they get COVID. But how has your operations changed because of COVID? Not obviously people wearing masks and being more careful and diligent, but you're not treating COVID patients as far as I know. So, but what has that your care level changed because of it in any way? That's the key question.
Yeah, I will answer that. I saw in one of the questions something about refugees. I just want to very, very quickly say that we treat refugees from many, many Arab nations. We have refugees from, of course, Syria, Iraq, Palestine, Yemen, Sudan, and Libya. We sometimes have, we've had a case of parents just literally coming and throwing their child in the emergency unit. So because I saw in the questions here for me that many people are interested in that. Jordan, as you know, is one of the largest recipient countries of refugees. So just to echo what Fawaz was saying, is that KHCC has also taken the brunt of it, and we have been very, very clear about it, that our doors were totally open to refugees. And I really hope that one day you will visit us, and when you go through the wards, you will see a Libyan child, then an Iraqi woman, then a Syrian, and it is they are very much made to feel at home at the King Hussein Cancer Center. This is about the refugees. About COVID, what we did is very, very early on, last February, March, we took measures at the King Hussein Cancer Center. For example, the first measures that we took is, guess what? No visitors. Nobody comes with the patient, because as you know, in Jordan, if there's a patient that comes into any hospital, you have a tribe of 20 people that is following him. This was categorically stopped. And of course, measures were being taken. Cancer patients, we all know, are totally immunosuppressed and cannot afford to get COVID. So we protected them, and thank God, really, we have been able over all these months to protect our cancer patients. We have taken many measures, like clinics online clinics. So now if there is any, I mean, unless there is an emergency, the patient does not need to come to the center. We deliver medications to them at home. They don't have to come and pick up their medications. For chemotherapy, there is, the portable machine, if you want, that they can use at home. For regular appointments, clinics, it's all done online. So the King Hussein Cancer Center has taken very strident measures in the COVID area because of our patients. Of course, no conferences, no events, nothing. Nobody who does not have to go into the center goes into the center.
Yeah, if I may add, also we dedicated one full floor for emergency in case of any of our patients got infected by COVID-19. We have a fully fledged floor for isolation, and we also dedicated half of one of our ICU units for our patients to make sure that they are also provided of care needed under our supervision. And of course, we expanded, we had before a home care program, but we expanded our home care program, and we increased the number of teams who are conducting home care on daily basis. We activated a 24/7 helpline for our patients also, to make sure that their queries, their concerns, their anxiety is being handled on the spot. And of course, we continued, and our team also made sure, and they are making sure until the moment that they are communicating regularly with their patients, and not only with their patients. I would like to add that we are taking care also of their families, not the patients only. In terms of psychosocial support, we provide support for the family members, not only for the patients.
Perfect. Given the time, I know it's a great discussion, but we'll take one last question from San Francisco. Very nice words. Thank you for that. The question I'm going to read is, providing clean air, water, and food are critical to minimizing cancer rates. Are these programs to increase awareness across the entire country about the need to improve the environment and minimize pollution in Jordan? Are there any programs?
Yeah, I will tell you what, again, this is one of our policy advocacy priorities. These parts are really the most challenging part. When it comes to any issue that have so many parties, so many players, so many, and different level of interest, and there is also some sort of conflict of interest of some people when we are addressing these issues. But what we do as the foundation and the center, yes, we are now, for example, revising all environmental and agricultural, if you wish, related policies, procedures, regulations, and even things related to pesticides, the components of the different materials that are being used here in Jordan. And it's on our agenda to expand our efforts in this direction as well. So here also, this shows and reiterate our role, not only as a comprehensive cancer center, but our national role to lead the cancer control in Jordan in terms of prevention, early detection, provision of comprehensive cancer care for all Jordanians. We are even sharing our expertise and our experience with everybody in the kingdom for cancer care and for other cross-cutting issues for the other non-communicable diseases as well.
يعطيكم العافية. We are very proud of what you're doing. We want to be your eyes and ears here in the US. We promise you to do everything we can to enable your mission and to free you up to do what you have to do, and that's cancer care. I appreciate everyone who took the time to learn more about the center. To donate, you can go to the khcfusa.org. I know I will. And as Princess Ghida mentioned, just be ambassador. Go tell that story. And whenever you can contribute to this wonderful mission, please do not hesitate. Tell your friends, tell your family. Anything goes a long way. Thank you, Your Royal Highness. It was a pleasure hosting you. Thank you, Nisreen, for the tireless work that you do all the time. Thank you, Fawaz, and good luck on your new post. Rami, it's always a pleasure to have you, and thank you for leading Connect at Joe. Until then, everyone, be safe, and hopefully to see you soon.
Thank you.
Thank you. Thank you, Fadi. Thank you, everyone.
Thank you.